Hi, Kinesiology 1018. This week we're going to go through chapter 12 on cancers. Okay, today we're going to talk a little bit about what cancer is, how it spreads. We'll also talk a little bit about how we can avoid it and go into some of the different common types of cancers and how they're diagnosed and how we can really take some steps to hopefully minimize or lower our risk of developing any of these. So cancer itself is an abnormal, uncontrolled multiplication of cells. It's a little bit more common in males than females. Right now, it's about 1 in 2 males and 1 in 3 females are at a higher risk of developing cancer. Most of these cancers start in a tumor. A tumor is a mass of tissues that grows and develops, and it serves no real physiological purpose or no useful purpose for the body. We have two major types, benign and malignant. Benign tumors are encapsulated within their own membrane and don't spread, while malignant tumors have an open membrane and these cells can spread throughout the body. This spreading is called a metastasis, or the spread of cancer cells. They pass into our blood vessels, our lymphatic system, and can spread to other tissues of the body or cause more growths in new tissues. We don't really know all of the causes for cancer, but we have some major kind of factors that play a role. Lifestyle, genetics, environmental factors, socioeconomic, different ethnicities all kind of play a role in cancer development. The first one is a lifestyle. Tobacco use. Smoking itself is responsible for about 32% of all cancer deaths. About 73% of cancer deaths in men and women. Tobacco use is responsible for nearly 1 in 5 American deaths and close to 500,000 premature deaths every year. It's linked to other cancers, mostly of the face and neck, and also of the stomach and pancreas. These are major locations or common cancers, and they're all linked back to tobacco use. When we go beyond lifestyle or further into lifestyle into dietary factors, having higher levels of dietary fats and meats, especially saturated fats, and highly cooked red meats have been linked to cancers. Alcohol and tobacco use, especially when used together, and especially foods cooked at extremely high temperatures. So some of these with high temperature food cooking, especially frying and really high temperature baking, can change chemical compositions in our foods and turn them into carcinogens or possible cancer-causing chemicals. And these are all kind of linked with more of our negative dietary habits, not those that are linked with our quality health that we talked about. Those positive dietary habits, like consuming higher quantities of fruits and vegetables, can maybe limit that risk because of antioxidants, the higher level of vitamins within those foods can help us in reducing cancer risk by fighting off kind of those metabolites when cells are dying or being broken down. They help with that process so that we don't have an uncontrollable growth of cells, especially malignant cells. Obesity and inactivity have been linked to different cancers. So we talked about how it's linked with cardiovascular disease. Obesity is also linked with cancer risk, especially those in the colon and some prostate and breast cancers. Okay? Excessive abdominal fat especially elevates that risk. So that apple shape where we have more of that visceral fat, visceral adipose tissue is linked or is greater link with those cancer risks. When it comes to DNA mutations may lead to different forms of cancer. Some of those mutations are inherited, some are from environmental agents. So that mutation in the gene causes the gene to be expressed differently than its primary function and may not allow those cells to grow and die as they would. They grow uncontrollably, and then that causes those tumors that we see. One of the more socioeconomic factors is poverty. Okay, people of lower socioeconomic status are more likely to have less healthy behaviors because they don't have access to maybe healthier foods. Maybe they don't have access to ways to be more physically active. Um, and we see a higher stress level in these groups. With high stress levels comes an impaired immune system. Remember back to our stress lecture. And this line of defense against kind of getting rid of those cancer cells is compromised because of stress, poor lifestyle habits, and less physical activity based on socioeconomic or environmental factors that are maybe out of that person's control. Okay, within that environment, there's other things like viruses and UV rays or synthetic materials that you may come in contact with during social interaction or um, interactions with your environment, maybe at work or where you live. Some industries have higher levels of carcinogens than others, um, but we think that about 2% of cancer deaths are related to environmental factors like pollution, often from the workplace. So this can be a serious problem if you're not taking those preventative measures at your workplace. It could put you at a higher risk. Okay. Talked a little bit about those environmental factors, also factors like microbes or viruses, bacteria, HPV, for example, or human papillomavirus is linked to cervical cancers and other cancers. Um, so infections can also lead to these higher cancer risk. So how do we detect, how do we prevent? Okay, detecting cancer, your first line of self-defense is self-monitoring, understand yourself, what is normal, and making sure you're taking all of those positive lifestyle steps that we've been talking about. Okay, once there um, is a cancer, or we notice that there is one, the exact size and location of that tumor, or those grouping of cancer cells will be noticed by the physician, and the extent of their growth or their metastasis will determine the treatment. So it's based on location, size, and extent of spread. Okay, so how do we treat it? Surgery is our first step. If we can remove the tumor, it's a very effective treatment. Um, it's less effective if it's related to the immune system or if there's more metastasized or metastasis. Uh, Once that cancer cell is spread, what we take out is good, but if it's spread to other tissues, we have to address it at those other tissues also. Chemotherapy is another way for us to target cancer cells through specific drugs. Uh, Normal cells are not destroyed by these drugs, but some normal tissues, especially those that are continually developing, because chemotherapy attacks growing cells. Some of those tissues, like intestinal tissue, blood tissue, hair tissue, that's always growing. Um, so those are ones that'll also be addressed or attacked through these chemotherapy drugs. So that's why we see a lot of nausea, intestinal issues, as well as hair loss when it comes to chemotherapy. It can have very negative side effects. Radiation is a more targeted treatment. Okay, so it's less toxic and it's often done outpatient, and we can really target those tissues with radiation to kill those growing cells. Some other treatments, immunotherapies that help the immune system target those cells, hormone therapies, so that we're manipulating hormones to maybe address those growth, stem cells or other kind of groupings or personalized treatments are also available. So there are many options. All of these options are growing. They're growing in their effectiveness, and we're working the best that we can towards developing the best treatment for each individual. But it must be very personalized and precise to the type, the size, and the spread of the cancer. So what are some common cancers that we need to look at that maybe we need to pay attention to? A lung cancer is responsible for about 150,000 deaths every year. It's one of the most common, and it's linked to cancers from tobacco smoke. And this is it's kind of a less known or less likely to be noticed early um, type of cancer. So during its invasive stage or during kind of like the first beginning development of lung cancer, it's very difficult to identify that it is a cancer. So we often don't kind of address it until it's already become more invasive, until it's already spread, until it's already killed more tissues or impeded other tissues. And unfortunately, about only 15% of patients who survive lung cancer are alive 5 years later. So, or who develop it are alive 15% after 5 years. So it doesn't have the highest survival rate, especially the 5-year survival rate. So early detection and lifestyle modification is our best step. Colon and rectal cancers are the third most common type of cancer. It's often linked to those who are over the age of 50. They should have regular screenings, because if you don't go through those screenings, we may not notice that it's there. And because it is so common, um, come from polyps, it could come from any number of factors, but screening can reduce the occurrence and improve the survival rate. So after the age of 50, it is extremely recommended to go through those regular screenings. Okay. Lifestyle, such as regular physical activity, having a quality diet, and lowering your obesity um, can improve your chances of not developing these types of cancers. Um, Breast cancer is the next one. It's the most common cancer in women. Um, Next to lung cancer, it's number 2 when it comes to deaths. And some of the risk factors are genetic. It's a very strong predictor of genetics. If someone in your genetic pool has had breast cancer, then you're very likely to also develop it. Um, Other things like um, obesity and alcohol use, all of those kind of negative physical or lifestyle traits that we have can also lead to things like breast cancer. Breast cancer does not only occur in women, it does occur in men also. Okay. It is linked to estrogen or higher levels of estrogen, because estrogen promotes cell growth, and adipose tissues also produce estrogen. So individuals who have higher adipose tissue and are female who are producing higher levels of estrogen, these two could escalate the development of those cancers. Um, so we really want to pay attention, know your risks, know your chances, and regular screenings can help prevent. Um, Self-awareness, if you see something wrong, it's go to a doctor, check it out, and have regular screenings with your physician to make sure that you, especially if you are at a higher risk, have not developed any kind of tumor or cancer. If you do have a lump or a cancerous tumor, they'll often have a removal of the lump. If they can't remove only the lump, they may have to undergo a mastectomy or a full breast removal. Um, then a combination of other drugs and chemotherapy to directly attack those cancer cells, especially if they've spread. Um, but there is about a 98% survival rate over the 5 years following diagnosis. So we've improved our treatments. So it's not as dangerous as it used to, but it is extremely common, and you should be getting checked from your physician regularly. Okay, with prostate cancer is the most common cancer in men. Um, in women, you don't have a prostate, so unfortunately, or fortunately, you can't develop prostate cancer. Um, but it's at a higher risk for those as you age or have family history. And then if you do develop prostate cancer, it will often be removed. But now if it's detected, there's nearly 100% survival rate. So detection is key when it comes to all these cancers, because we need to know it's there in order to treat it. With prostate cancer, it can be detected with a rectal exam, and then often secondary with ultrasound and biopsy to confirm. There are also some blood tests that can be used, but we'll often use rectal exam and biopsy as our two keys for diagnosing and then proceeding treatment for prostate cancer. And for women, cervical cancer happens often in the 30s and even 20s, so it's kind of a younger cancer for women. It's largely linked to HPV or human papillomavirus, and with um, screenings like the Pap test, there is a good chance of detecting cervical cancer and treating it effectively. With other cancers of the uterine and endometrial cells, these often happen later on after the age of 50, but they can be detected with a pelvic exam and then surgically have those tumors taken out, or having other organs taken out with chemotherapy and other treatments. So it's often a combination of treatments with each specific cancer, specific to where it is, its size, and how it's spread. And with ovarian cancer, this is a rare form of cancer. And because it is so rare and it's very difficult to detect, it causes more deaths. So some of the early symptoms are bloating, pelvic pain, difficulty eating, and other urinary problems. So if you see some of these problems and you're getting checked regularly, just ask some questions. Hey, how can we test for this? I know that I may be at a higher risk or at a lower risk. Okay. Um, in the event that there is an ovarian cancer, surgical removal plus an additional maybe chemotherapy or radiation or other immunotherapies based on the spread. Um, one that we can see a little bit more easily is skin cancer or basal cell carcinomas or melanomas. These are often linked to excessive UV radiation or sun exposure. Things like sunburn, suntans, especially if they're chronic, frequent exposures, it can lead to developments of skin cancer. What we really want to pay attention to is if you do have any kind of um, growth on your skin out of the normal, out of what you've had forever, or even if you have one that you don't know about, have your doctor check it. Just hey, I have this. Is there anything wrong? They may take a biopsy um, to confirm. Other cancers, like head and neck cancers, are often linked to um, different tobacco uses and alcohol consumption, and often the combination of the two. It can also be related to HPV, and it occurs more often in men than women. So these are head and neck cancers like oral, pharynx, nasal cavity, other cancers of the head and face. The survival rate is good, but not as good as we'd like. Early detection and limiting the exposure to those other um, negative lifestyle choices can help with reducing our risk. With testicular cancer, it is relatively rare, but it happens in more younger men, so ages 20 to 35. Um, so it becomes more common in those younger ages compared to older ages. Self-examination can help you with early detection if something feels wrong or sizes change, shapes change. Um, Talk to your doctor, consult your physician, get checked, and it'll often have a surgical removal, and chemotherapy, and then really hopefully if there's no spread, there may be other treatments depending on the spread of that cancer. But the survival rate is very good, especially with early detection. So make sure that everything is normal. Check, make sure if anything's changed, consult your doctor. Okay, other cancers we'll talk about are pancreatic cancer. Um, this one is very difficult to um, notice or difficult to diagnose because there are very few symptoms until it is already metastasized and grown. So it is one of those very dangerous kind of silent cancers. Bladder cancers are also ones that we need to pay attention to. Some of the first symptoms are blood in the urine and increased frequent urination. So if you see blood, often if you see blood in your urine, you should go see a doctor or talk to a doctor. And then if you have also frequent urination, you may want to talk about bladder cancers. Okay. Kidney cancers also occur later on in life. Most of these cancers are a little bit more common in the post-50 age group, but there are those few that aren't. And smoking and obesity are some of those key factors that come in there. Brain cancer is one that is extremely dangerous. Some of the risk factors are radiation, especially to the head. But these can arise for no reason, and they can arise at all ages. Um, but really, if you can't have surgery, so the first step would be surgery, next would be radiation. But the survival rate is very low with those brain cancers. Leukemia is an immune system cancer where it starts in the bone marrow and it spreads. Lymphoma also in the lymphatic system, in the lymph nodes, and spreads throughout the body. These are very difficult to handle or difficult to um, diagnose and treat because they spread so quickly, because they develop within the areas of the body that are constantly transporting things throughout the body. So those cells, those metastasizing cells, spread and spread very quickly. So they can be extremely dangerous and extremely deadly. Right? Thank you for watching our lecture on cancers. go through your lecture for chapter 13 on Blackboard, and I look forward to seeing you soon. Thank you.